Grocery store. Somebody owns the grocery store, and it ain't the grocer anymore. It's the guy who created the problem in the first place. Okay. I'm not into criminal conspiracies here. I'm not here with my foil hat on my head to talk to you about conspiracy theories. What I'm presenting to you is the natural result of fallen human nature meeting statist government mentality. And now everybody's on their own trying to work their piece of the action here, try to protect their piece of the pie. This is what happens when governments become unjust. People start losing track of their moral bearings and doing unusual things, playing with their moral life. Okay? It undermines normal moral relationships. And the more centralized you make the process, the more you undermine the local relationships that kept the whole thing just. People keeping themselves honest at the local level, knowing each other by name, knowing the doctor, knowing the hospital, right? Knowing the banker who's holding your money that you use to pay for your bills, whatever. Okay. The objection is, well, that's not true. None of that's true, because I know what's driving up the cost of health care. These are the 4 reasons that are given for the rising cost of health care. Everybody knows this. Inflation. Obviously, inflation is driving up the cost of health care. There's all this litigation business, and I don't have any time to talk about tort reform, but everybody knows litigation. Technology is probably the one that leads everybody's thinking in terms of why health care is expensive. And of course, you don't have to make a very long case for why bureaucracy makes everything expensive. But let's look at those in detail. Inflation. At present, medical costs are outpacing inflation by more than 2-fold. In the 10-year span since 1999, health insurance premiums have increased 120% compared to the cumulative inflation of 44%, while wage growth only went up 29%. Okay? So there's something going on here that isn't inflation. When coverage is mandated, when the government says it's making arguments like we're hearing today, you will not be denied coverage because of pre-existing conditions. Sounds like, wow, right on. Yeah, that's what we want. We want coverage, and they won't deny me because of pre-existing conditions. Well, what's happening is the federal government is telling an insurance company that they can no longer manage risk. What's up with that? It's like telling the fire department they can no longer use water. I mean, it's the same idea. The way that an insurance company survives is they manage the risk pool, and they have actuarial tables that tell them what's the likelihood this is going to happen, and they base their whole premium and payment structure on that. Right? Stop me if I'm wrong anywhere. Right? That's how it works. So if the government steps in and says, you're going to insure people regardless of the risk, well then essentially what you're doing is you're driving private insurance out of the game. So you don't have to say single payer, government payer. You no longer have to speak. You can manage political risk now simply by saying things that people will agree with, like, oh yeah, they can't deny me because of pre-existing conditions. Well, yeah, that's what they're supposed to do. So the government can drive private insurance out of business by appealing to your misguided sense of justice. Okay? And in doing that too, now what does the insurance company do to protect themselves? All right, yeah, you got to insure these people. Well, all right, we'll insure them. Premiums are going up though. And payment to physicians, payment to hospitals got to go down, otherwise we don't stay in business, right? So what they're doing is they're making the insurance company less fiscally sound, and they're apart from driving them out of business, they're having a tremendous impact on the people who are providing the service. Blue Cross Blue Shield of Alabama plans to cut payments to physicians by 20% next year. This is a significant hit. It's a huge hit. But this is why they do things like that. Because if you cannot manage risk, you got to manage it in terms of how much money's coming in and how much money's being paid out. That's how it all works. So, how about litigation? Okay, these huge settlements for malpractice, right? The settlements for malpractice cases is based on this fiction about what the cost of care is. So, for example, you do something and you produced somebody who is amputated leg because you mismanaged their diabetes or something like that. Well, they'll go in there and they'll calculate, well, the care of this diabetic for their expected lifespan of 30, 40 years is X dollars. And that calculation is based on the fiction of what medical care is costing. They're not saying what we're actually paying. They're saying this is what the bill says, right? And the estimate's based on inflation, which is actually 2 times higher than the real inflation. All right? The fact that that juries of lay people are the ones that make these decisions about did something bad happen. At the same time, fear of this litigation promotes us, hospitals and doctors, to pay ridiculous amounts of money for malpractice insurance. In some markets, it's driven whole segments of healthcare out of business. In the Miami metro area, you can't find an obstetrician because the malpractice insurance is so high that you can no longer practice. So if you want to have your baby, you're living in Miami, you'd probably drive to Fort Lauderdale. I don't know how far you got to go. Okay, how about high technology? High technology, everybody knows. I mean, it's really expensive. You get a new CAT scanner, one of these spiral CT scanners, MRI, you know, these cath labs and stuff. This is high-tech stuff, and that's expensive, and we all demand the best. I mean, if you go to a hospital and they don't give you their best and something bad happens, well, you've got grounds for a lawsuit. So everybody wants the best, they demand the best. And the way people view it is they adopt one of these two flawed thought processes. You either got to pay big premiums to a top-flight policy, right, survival of the fittest, that's the Darwinian approach to healthcare, or you got to start rationing care because high technology is too expensive and we can't give everybody that care, so we're going to ration that care. High tech, high price. Well, here's the UNIVAC of 1958. They only made 2 of them. They were so ridiculously, exotically expensive, you know, occupying an entire refrigerated room to keep this thing running. They only made 2 of them, and I think they both went to the government. One of them to calculate your taxes. All right? So, still in use, yeah. I think you're right. So if you fast forward 30 years, I got a picture of my original desktop computer, which was an IBM AT clone, right? And I remember agonizing, do I want to spend that extra $200 to buy 40 megabytes of hard drive, you know? And then so that was $2,300 bucks. 20 years later, I got this Mac, top of the line Mac. Okay, inflation-adjusted dollars, this should have been about a $4,500 computer if it was exactly this technology. It should be about $4,500 bucks. I got it for $3,000, so I actually paid considerably less, right? Over 30% less for a computer that's probably 10,000 times more capable, if maybe even 100,000 times more capable than what I had then. This is just a single example. The examples are legion. Every other area of human endeavor, when you apply high technology to it, what it does is it makes it more available to more people at a lower price. It's the history of the American Revolution, the history of the American technical revolution. This is what made us who we are. It's the fact that we recognize this. We go, you know, you give people the right to intellectual property and to personal property, and you establish a patent system that allows them to gain from their efforts, and the place goes nuts with technology, right? And your farm production goes up, and your transportation system gets cheap. Everybody's driving a car, and everybody... So, does high tech cause high price in medical care? No. Anytime you introduce something new, it's expensive. But the impetus is to make a lot of those new things to make your money before your patent runs out. And within a couple of years, it's cheap. Right. All right. So, I think I just beat that one into the ground. Next. So, of these things, the 4 reasons why healthcare is expensive: inflation? No, it's not inflation. Litigation? Yes, there's a problem. Technology? Definitely not. Bureaucracy? Definitely yes. So these are the 2 things we have to address. Right? Litigation, I won't talk about that today. The bureaucracy. How do you control cost? I mean, this is what we're talking about. Is health